Thank you very much, ladies and gentlemen, and welcome to this panel discussion on how government uses AI to forecast demand for public services, allocate resources effectively, and address the emerging needs of citizens. And we're looking for wins and the unintended consequences. I believe we'll be joined by one panelist online, and then we'll be joined, I think, by Justin Fasahi on stage. So if I may, okay, Andrew is already online. And each of the panel members will start off with a 15-minute presentation, followed by a Q&A led by me, and then we'll turn it over to the audience to talk about something that I think is particularly exciting, thinking about new data services. Andrew has written a very interesting paper on the Western Cape hub, and as well is now doing some work on HIV and as well as health information systems. So Andrew, I'll turn it over to you, and then we'll have Justin join us on stage. Thank you.
Great, thank you. So let me just check that you can hear me okay, and that you can see my screen.
Yes, Andrew, we can see your screen. We can see you. So
great.
Go ahead. Yeah.
Fantastic, thank you. So thanks to the organizers for the invitation to participate in this session. I'm a doctor who's spent most of my career working in public health, working in the public sector, working with public health data. You may have thought that you would be hearing a lot of seeing a lot of impressive advances in technology and AI and in this session, but in fact, I'm going to really focus on the challenge in government of being able to leverage technology and build competence in government to use emerging technologies. So I'll tell you a little bit about my journey in health data, and then I will and our journey in government developing competence to work with large amounts of health data, and then I'll pivot to trying to talk to some of the challenges and where I believe we can really make a difference. And you'll see as well that I've changed the title. I was given the title of the use of AI in streamlining and optimizing service delivery, and I've changed it the use of data and AI because I believe that the fundamentals of data integration are absolutely essential. In the slide on screen, on the left, you'll see a picture from a program I was privileged to participate in early in my public health career, where we were supporting an initiative of government with civil society to advocate for HIV treatment at a time when our national government hadn't yet embarked on the national treatment program, and when there was a lot of skepticism globally and nationally on the ability of government to deliver treatment for HIV because of its complexity and its cost, and skepticism about the ability of African patients to be adherent to treatment. We firmly believed it was a moral imperative that treatment be provided to everyone with HIV and who needed it, and that it was definitely feasible and that costs would come down. The picture on screen was a celebration in 2003 when we reached 400 patients in the public sector on treatment. So in the context of having 6 million South Africans on treatment now, it's hard to believe there was a time when it was an effort to get to 400 people on treatment. And at that point, where we reached 400 people on treatment in total in the public sector, notwithstanding a couple of other initiatives that were happening at the time, 600 people were estimated to be dying every single day from HIV. Over time, to track this cohort of people, increasingly large cohort of people with HIV on treatment, we needed to link the cohort to clinical services, clinics and hospitals, to laboratory information, to pharmacy information, to mortality data, to TB data, and many other data sources. And we realized that the journey we had followed for HIV was replicable for all of healthcare. And that led us to want to integrate data across the whole of the public sector healthcare system. And in fact, there was an emergent architecture that facilitated this, and that's on the right of the screen, which is the Health Information Exchange architecture. And I think we've heard a lot from other speakers already this morning about interoperability. And in healthcare, it's an absolute necessity. In most health jurisdictions, there are a multitude of different systems, provider-facing and client-facing systems. And in order for providers and clients to have all of the data available at the same time, it's essential to have a framework for interoperability, and this is very mature and well developed in health. I'm just checking, are you able to see my pointer on screen?
Yes, Justin, we are. Sorry, yes, we are, Andrew.
Yeah, perfect. Okay. So the idea is that there are very well established standards for interoperability. And so all the systems that are facing providers and clients use that interoperability layer to talk to a backend that has got these repositories, which are quite self-evident. For example, a registry of every single beneficiary or person in the system, a registry of every health provider, a registry of every health facility, a registry with all the clinical data that's collected against individuals, a list of all the terminologies and coding systems that we use. And that is the principles of a health information exchange. And South Africa was one of the front runners in Africa in adopting a health information exchange strategy and the health normative standards framework, first published in 2014. So it's definitely, we have a framework with which to operate. And the other reason why I enjoy sharing the HIV data journey alongside the integrated data journey is there's similar skepticism that gets expressed about the ability of government to work with person-level health data. So remembering that the history in government has been aggregate health data that's collected and analyzed indicators, and here we're talking about huge volumes of person-level health data, and there's been consistent skepticism as to our ability to build these skills, build these competencies, and build these systems in government. And we firmly believe, as we did with HIV, that it's an imperative and it's definitely possible and feasible. So 10 years ago, we started the journey in the province where I work, leveraging a unique identifier. So I've heard people talk about digital identities this morning, and in healthcare, the global guidance is that the digital identifier for healthcare should not be the same as a civil identifier. Not everybody who needs healthcare has a civil identifier or feels at liberty to share the civil identifier. The civil identifier is not necessarily privacy preserving, whereas a unique health identifier is globally recommended. My colleagues where I work had spent 10 years previous to this ensuring that every single hospital and every single clinic had a system to register patients against a 9-digit unique identifier. And in fact, South Africa has adopted the health patient registration system, which is a unique identifier for healthcare countrywide, which uses a 10-digit numeric, of which the Western Cape 9-digit identifiers are being subsumed. And this makes it much easier to integrate data. So we can take every single available data point that's linked to an individual and integrate it against this identifier into a data environment, a consolidated data environment, which we also try to ensure operates as a functional health information exchange, in addition to being a repository of data for analysis. And being a functional health information exchange, the primary focus is service delivery. And this is quite an important distinction, because we often get pitches as government from purveyors of new analytic techniques to say that those techniques might offer value to government. But in fact, if one were to go straight to trying to analyze data that hasn't been well curated, hasn't been used, hasn't had a virtuous information cycle emerging from use, the analyses may not be that valuable and may not actually benefit patients that much. However, if we start with providing clinical records to clinicians, integrated data to clinicians who are treating patients, and identifying those patients who need our intervention, we automatically generate data sets that offer value when analyzed. We had quite a lot of hubris when we started this journey, thinking that if we built these technologies, they could become, I also heard the term digital public goods, they could become a public good, open source, that could be used by others and accelerate the journey that others could take to get to integrated health data. But what we learned with time is our biggest asset was actually the people. Having established people who had good domain knowledge, good technical knowledge, and knew how to use the tools available to them in government was the biggest asset. And when COVID hit us, we really felt the value of our workforce, who were able to pivot very quickly to use the tools available to them to build outbreak response systems and to build a whole host of systems to support the service response to COVID. On the right, I've listed a whole lot of cadres of staff. And I heard the DG of Treasury this morning saying how difficult it is to find data scientists or to hire data scientists in government. And if you look at those cadres and you look across the health departments, you'll find very, very few formal positions for those posts in the services. And yet when you look in the equivalently sized private sector institutions, then they might number in the hundreds. So there really is a gap in terms of our capacity, our resourcing for these staff cadres in order to be able to leverage integrated data in healthcare. A second point I want to make is that one of the responses to this challenge in resourcing of those staff cadres is one of the responses is that we could centralize these functions. If we could do this once for the country, then surely we wouldn't need to have as many people with those skills. And that is actually a false assertion. So there are a lot of very important nationally hosted systems, and there's a very important national role in stewardship of health information systems. And for example, some of the systems that are listed at the top here, the master facility list, the National Health Laboratory Service, the vaccine system, the patient registration system. And those are all fantastic shared assets nationally. But at subnational level, and I say subnational because it doesn't have to be a province, it could be whatever entity we use to deliver and coordinate care at a subnational level. There's a whole lot of systems which are varying at a subnational level. The ambulance system, the dispensing system, the theatre and emergency systems, the radiology systems, the referral systems, the patient portals. And there's no way that a single national entity would be able to curate those data from all of those systems in one go and make them functional and available to everyone. However, if at the subnational level you have data competence, you have people who are proximal to the staff that are managing and interacting with these systems, curating the data, virtuously improving those systems, and then being able to share curated data in a standards compliant way upwards, whilst also leveraging the data that's coming from the shared systems downwards, we really have a virtuous system. So it's never an either or, it's always an and we should avoid falling into the trap that we can solve the data competence problem by centralization only. So to pivot slightly to some of the challenges facing the public sector, and I'm going to go back to the HIV example. So for any chronic condition, we seek to identify everybody with the condition, make sure that everyone knows their status, make sure that they all get the appropriate treatment. So in HIV now, every single person with HIV should be on lifelong HIV treatment, that we assess that the treatment is working. And for HIV, if people are taking antiretrovirals and the virus is suppressed, then we know that the HIV won't be impacting the immune system, and disease progression is much less likely. And so that's our aim. And the same applies for almost every chronic condition. In South Africa, half of our adult population have at least one long-term health condition. So the burden for the public sector is absolutely massive. And going back to HIV, at any point in time, of the 8 million people living in South Africa with HIV, up to 30% might be off treatment at that point in time. And not there's a variety of reasons. Our services are sometimes difficult to access. Patients' lives are challenging, and staying on treatment is a challenge. And similarly, of those on treatment, there's quite a substantial proportion in our setting, about 15%, who have recently restarted treatment, meaning they were quite recently in this group of people off treatment and have now re-entered care. So these two groups in red are the ones that really need our attention as the health service, whereas there are groups of people who have been doing extremely well and need very little from us, and yet we bring them back to our services month on month or every 2 months, just so that we can confirm they're in care, because we haven't joined the dots. We don't have the digital systems to track them, and so we keep overwhelming our services with people who get very little out of spending the whole day queuing for the services, other than being able to get their medicines. So this brings us to why joining the digital dots can really transform service delivery in healthcare. And this is a busy slide, but I'll take you through it. In the middle here is the service delivery platform.
Andrew,
we're very familiar.
Andrew, I'm going to ask you to move to a close because we've run out of time, unfortunately, and we will pick up some of these points in the Q&A. We have Justin in the room, so could you move us to a close, and then we'll welcome Justin on stage, and then we'll have a Q&A discussion.
Yeah.
Thank you.
Perfect, thank you. So the point on these last few slides is really that by joining the digital dots, we can really enable not just facility-based care with longitudinal health records, but we can also enable digitally tracking everyone who needs to be in care, but through a variety of diverse care delivery channels, and have a safety net for them, so that we can identify who might have fallen out of care and immediately react digitally, and also action whatever actions need to be taken to try and optimally care for those patients. I've talked very little about AI, and I would have talked very little about AI other than to say that there's pluses and minuses. I think some aspects of care are going to be made more efficient, but there's also going to be more sophisticated care that's going to, people have talked about the equity gap, that are going to require, that are going to be harder to deliver compared to our very standardized treatment guidelines at the moment. And I had a section on data governance, and we are moving towards trusted research environments and secure data environments, which many people fear, but are actually going to be massively enabling. So once data custodians know that their data is safe, and even de-identified data can no longer, in most countries that are well resourced, they no longer share de-identified data for analysis, but rather bring those who need to work with those data into secure environments. And this absolutely is the only way in which we're going to be able to leverage our data assets in healthcare. And that the overall objective is to free up healthcare workers to do their job, which is to care with the human touch, and try to make the rest of care delivery as efficient as possible. Thank you very much.
Ladies and gentlemen, without further ado, I call up Justin Visagie to talk about the spatial economic tax data. Thank you.
Sure. Thanks, Keta. So I know you cracking the whip there, so let me get on with it. Similar to Andrew, I've sort of been asked to share a practical example of how using this new digital age of information can actually make a difference in the public sector. And I suppose I'd like to achieve two things through this talk. The one is, hopefully some of what we're doing might actually be useful to many of you in government in terms of understanding local economies. But the second is I think it serves as a clear example that we can actually achieve a lot. And I think we should do more to try and achieve those things. So let me be practical. And I thought one way of getting into this discussion is in a different domain. Oh, I think this is my slides. There we go. Which is, do we have any Formula One fans out there? Okay. So if you just type big data in Formula One, you'll be amazed at what comes up. You know, this is just one of these nice sort of information sheets. But literally the cars are generating terabytes of data. And to give you a sense of how much that is, one Grand Prix generates as much data as about the US Library of Congress. Okay? They've got hundreds of sensors. And all of this just to get those four wheels around the circuit as fast as possible. And I suppose our provocation is, you know, what if we had the same mindset about service delivery, right? What if we have the same mindset about how we can use information flows that are already going on to try and better understand and then improve how things are done? So in my own field as an economist, this is just showing you research drawing on administrative sources, and it's quite dated, but you can clearly see the upward trend that people don't just rely on the traditional surveys any longer, but they're tapping into these digital flows. And I mean, I think if we had data up to the present, you would see that, you know, the trend is sort of exponentially upwards. These are all the four biggest economic journals, and you can see how research increasingly is drawing upon it. Of course, data, administrative data, big data has its pros and its cons for decision making. You know, one of the I'll start with the advantages, is there some improvements in accuracy, right? Sometimes when people answer a survey, they're not honest for whatever reason, and you can reduce recall bias. All of this is really helpful in getting more accurate information. The second, which is also really attractive, is that it's comprehensive. You know, you're getting information on everyone, where if you try and go into the field, it costs a lot of money, costs a lot of time, and you only get a fraction of the total population. It's also longitudinal. So because it's always going on, it's not just a once-off activity, but you can then assemble the data over time and build up this asset, and that can really help with the decision making. And because these data flows already exist, it can be fairly cost effective. But there are disadvantages. It's not a purpose-built tool, right? So you sort of have to work with what you've got, and that limits its scope and its flexibility, and you'll see some examples in our own case. Usability, is the data ready? Trying to get it curated, able to share with those who want to use it. And then, of course, trying to access it and share it. Sometimes this can be sensitive data in and of itself, and our ecosystem is still maturing to the place where you know, we can sort of join all of these things up together. So I just want to also echo Andrew's sentiments as he was talking about, you know, is centralization kind of the answer here? And I think in this conference today, a lot of what we hear about is kind of at an institutional infrastructure level, where, you know, do we have the necessary pieces in place so that we can actually harness these data flows? We've got a whole lot of the new Statistics Act Amendment Bill talks about the data ecosystems. We've got the new national data and cloud policy. We've got from the DSI their big data strategy. So we've got a whole range of things going on. We've also got the Spatial Data Act. So we've got a whole lot of these pieces that are sort of floating around. But I'm going to tell you the honest truth, that if we just wait around for all of these things to come together so that you can get given a system and a platform that you can use to help you in government, I think you're going to be waiting a long time. There's the other side of it, right? Which is from the bottom up, thinking about your sphere of influence and starting to harness that potential. And I think as these two things come together over time, we can really make a difference. Both of these are, you know, oversimplification. In reality, real world, it's really messy and it's really complex. So what about our own case? So I lead a project called Spatial Economic Activity Data South Africa. And really the problem statement as an economist is sort of this thing of geography really matters to the economy. I think we have an intuitive sense as South Africans. You know, when you travel from one place to another, rural, urban, different provinces, different cities, within our cities, townships, you know, space makes a very big difference in terms of what's really possible in terms of our economy. And yet, our ecosystem from Statistics South Africa side has never been driven by spatial information. Yes, we do have the census, which gives us a focus on households, but when it comes to the firm and the economy, we just haven't had this lens, certainly not in enough granular detail. And so the Sustainable Development Goals ask our municipal planners to create more resilient and sustainable economies, but they don't really have the evidence base or the data in which to be doing that, because you know, we haven't had that in place. So, you know, even basic questions. What's the GDP of Johannesburg? Do firms in eThekwini complement or compete with firms in Gauteng? What's the economic trajectory of our metros and CBDs compared with other nodes? Which sector created the most jobs in your local economy? These are really basic questions, but we actually haven't had the answer to them in our current statistical ecosystem. So what the project essentially was part of is, well, just a prelude. It would be nice to do an economic census, but it's going to cost billions, right? So what's the answer? Well, the breakthrough has come in saying, well, can we look at our administrative sources of data? And one of those being tax data, as we heard earlier with the DG and the SARS Commissioner. So this is the sort of value chain that we've got going for the project. In SARS, they've got raw records about employment, about firms. You can think about the PAYE information, the RTR14, which comes from income tax returns, VAT, customs, all of this, really important economic data. This can then be processed in the secure data center that's run by National Treasury, run by UNUWADA on behalf of National Treasury, and I think we've got a session in the future exploring this. But essentially, we can use that data center to curate the information, spatialize it, and then release it in a format in which other people can use it for their decision making. Part of the innovation has been that we're not releasing information about particular people, because that would breach all sorts of sensitivity, confidentiality issues, but because we're releasing information about places, it's being aggregated in a safe way to be sharing. And actually, you know, we can now finally start to understand these trends about local economies. A lot of collaboration just to do this, you know, from the primary partnership driven by the HSRC and coming from the city's support program, but a range of other partners within the ecosystem that have had to sort of align themselves to make this possible. But also really important, service delivery driven by demand at the ground. So talking to the metros themselves about what kind of information they need to make better economic planning and decision making. And so I'm pleased to say that I think that the creation of a spatial tax panel is now a national asset. We've got more than 100 open access databases. The data for the 2023 tax year has just been released. Almost a 10-year time series in the process. I mean, that's pretty phenomenal, right? Field work will cost you so much money, and almost instantly, now we've got 10 years worth of time series, and we can keep on adding to it. It's very granular. You can cover province, district, municipal, and neighborhood level for the metros, and you can really zoom into these key themes of local industry, job creation, wage levels, gender, youth, etc., etc. We've got an open access portal, so part of the journey is also saying there are limited skills in terms of data science, so how can we make sure that this data can actually be used? And if you go to spatialtaxdata.org.za, you can use our tools. So for instance, you can use our dashboard tool to pick your municipality, and it'll take you through a series of curated analytics to help you better understand what's happening. Or you can use our Map Explorer tool to actually visualize different elements of the economic geography of the country. What's been really exciting, though, is actually the use or the testimony from our end users themselves. So here's some examples from the city of Cape Town who are using the data for all sorts of their policy and planning purposes, in their cost-benefit models in terms of which infrastructure to invest in which sort of suburbs, and also some specific things, like they had an issue about copper theft, and they could use the tax data and link it to the particular scrapyards, which they had information about where those scrapyards are. So there's so much that can be done if you make this stuff open and just push it out there. The potential for transformation is really big. This is an example from a colleague in eThekwini, and I'm hoping that our video, which is 2 minutes of his testimony, we can play. So let's see if it does.
So how do municipalities take advantage of the spatial economic activity data and make use of it to improve their processes? Well, I'll tell you what we've been doing in eThekwini. The first thing is we really wanted to understand what's happening in between our wards, which ward is more competitive on certain metrics than another, and so forth. Having specific location level data allows us to do this. So the spatial components of this data are really critical to municipalities because we have to make interventions in specific locations, specific townships, specific presence in terms of industrial areas and central business districts. You know, for us in Durban, we have Pinetown, Amanzimtoti, Umhlanga, and the main CBD. So we want to be able to compare activity that is happening there to have policies that are targeted and very specific. And this data allows us to do that. And we also have a bigger chance of reducing economic disparities between these regions within a city. A city is not just, you know, all the same throughout. In the outskirts, you have these rural areas, especially in eThekwini. We also have tribal-owned areas that have their own dynamics. We want to be able to track that and reduce disparities, and this data gets us a step closer to doing that. Internally, what this does is it helps us improve our decision making. We're now able to make decisions based on data as opposed to based on some loose knowledge, but without any specific data tying us to specific locations.
Cool, thanks. We'll just go one slide back. So maybe just a sort of 1 minute final reflections. Thanks. So what are some of the lessons from our journey? I mean, I think the one thing is slowly but surely, okay? So I'd start small, start somewhere, and build trust and deliver on that value with a realistic workload. Too often, I just, in so many meetings with government departments, all about frameworks and planning, but actually, can you try and identify something tangible, something small that you can experiment and make work and build out from there? Second, I think it has to work collaboratively. I don't think everyone has all the skills, so can you find partners that do have the skills that can come alongside you to support you in the process? We definitely need to find champions, those within our institutions that have the energy, that have the passion, and building those relationships. And being flexible and responsive, you know. As I say, one of the things with administrative data is you sort of got what you've got, so we need to try and work within those parameters. But it's not all good news. There are limitations too, right? Data is certainly necessary, but it's not sufficient. So I think for us into the future, we need to do a lot more to train people about how to use the data and turn it into knowledge and intelligence. Just the data in and of itself is a starting point. Yes, we need the evidence base, but actually being able to make sense of it is another whole journey. The technical expertise, again, can be a constraint. So we've seen Cape Town and eThekwini come out front, doing amazing things, but not all metros, and certainly not all municipalities across the country. And so how can we, again, from the top down, be thinking about building these capabilities and skills in government? There can be legal and bureaucratic hurdles in the process, even within strong partnerships. So, you know, trying to improve the quality of our geocoding, and we've had issues about our suburb layers. You know, there are definitely always going to be constraints, and it can slow you down. And as I sort of referred to, the sort of data ecosystem landscape in South Africa is still maturing, where we can actually have the interoperability of these different data sets. But to end on a positive note, I want to encourage, if everyone in this room and everyone online went back and thought about their area of expertise, their area of government, start thinking about what are the data flows that are going on, and how can you start to actually tap into them to do something. And I think this top-down and bottom-up will hopefully meet somewhere into the future, and then we'll really improve on our service delivery. Thanks so much.
All right. Thank you, Justin, for that presentation. And if you haven't been, Justin? Okay. And if you haven't been on the website, the spatial economic activity data, it's a very interesting data set. I was playing around with the dashboards yesterday, Justin, and that's really exciting. Do we have Andrew on the line? Do we still have Andrew on the line? No.
I'm still here if you can hear me.
Okay, great. Andrew, I apologize. I did have to cut you off, but we've saved a bit of time from Justin's presentation. I wondered if maybe you were about to reflect on the role of artificial intelligence. I think for many, certainly me in the room, have engaged with artificial intelligence in the context of large language models. But I wanted maybe to allow you a chance to talk about thinking of training and inference and the role of artificial intelligence in the health information exchange. And then, Justin, we could then talk about this point that you're making around capability. And if you could reflect on capability as well. Andrew, I was reading your paper on the broader sort of health hub that you've created for the Western Cape. And how do clinicians, and in this case, in your case, Justin, how do town planners think about that? And how do we build up that capability? If you could give us some of your reflections. But maybe give us a sense, Andrew, because I guess there's the very popular version of artificial intelligence with large language models. How does this in your world work, and the role of artificial intelligence?
Yeah, thank you. So I think in healthcare, we're going to really see an explosion of AI. There are challenges in terms of regulation, certification, etc. But anything in the diagnostic space or the personalization of therapeutic space, we're really going to see those developments, and we're already seeing in diagnostic radiology, for example. Dermatology, there were 2 examples that I had on the in the slides, but anything that involves pattern recognition, a lot of specialist clinician resources could be made more efficient with some of the AI technologies that are emerging. But the personalization is also going to be harder to deliver than our very standard approaches at the moment. So, for example, we'll have a national treatment guideline that says everybody gets 1 regimen of drugs, and only those for whom the drugs aren't working can then flip onto the 2nd regimen and then the 3rd regimen. Whereas in a personalized therapeutics approach, we would want to tailor treatment based on various things. It could be genetic, it could be related to the genomics of the pathogen. And so that becomes more complex to deliver. So I think we're going to see pluses and minuses. But what I think we sometimes miss is the ability of new analytic approaches, including AI, to ease our inference and our linkage. So because I didn't get the chance to emphasize this point, but we are quite unique in South Africa. We have a large amount of health data in the public sector, like our National Laboratory services entire public sector through one database. It's quite unique in the world. And yet we have very limited clinical coding because our clinicians don't need to submit codes to be reimbursed as they would in a health insurance system. And so we often have to make sense of the data using drugs and laboratory tests and where people sought care as a proxy for coding. And all of those inference approaches, as well as linkage without perfect identifiers, can be improved with analytic smarts. And I think that's where people often think about the analysis on top of clean data, but actually using AI techniques to produce or to beneficiate data for further analysis is a role that is often underappreciated, and we see that as a very important role, bringing those techniques into the health exchange to help with linkage and to help with inference.
Thank you. All right. Justin, you've worked, of course, on the city's economic outlook. I'm not too sure. Is this the second edition, or I don't know how?
I think it's the first edition.
The first
yeah.
edition.
Yeah.
Just tell us about the impact that you've had with the city's economic outlook, and how do you? What insights are you picking up around driving this particular local lens of economic development?
It's a great question, Keta. I think maybe first just to touch on the issue of capabilities, because I think it's a good thing to raise. I mean, we saw from Lucy's presentation that report about the number of data science skills, being hopelessly underwhelming in the country. And I think it highlights the importance of collaboration and partnerships. I don't think it's sort of realistic to expect all those skills to exist within government, but you can certainly try and find partners out there to support the process. But one of the mitigating factors is that we can also think about the project that we're trying to do and the outputs, and part of that process thinking about how to make it accessible, right? So in the case of our spatial economic activity data, we could have just released a whole lot of open access databases and put it into the world, and I'm sure it would do something, but actually part of the project is creating an online portal and an interactive tool that you don't need a degree in data science. You can go on there, you can pick your municipality, and it can sort of hold the hand in some senses. So I think technology can help mitigate, but of course it's a big constraint. In our own case, our end users are people in local government, right? So we don't face the same challenge that it's not the average Joe on the street. So that certainly helps. The other thing that we're doing, though, as part of the project is trying to raise resources to run a community of practice for local government in the space of digital economies. Again, as a way of acknowledging that the data in and of itself is just the starting point, but actually moving from data into knowledge, into sort of real change in behavior, is a bigger journey. And then it relates to what you were asking about our city's economic outlook report. So that's one sort of knowledge product that we've put together. The reason, and there's only been one so far, is because we haven't had the data to produce cities' economic outlook reports. So in some ways, it's a big celebration to have been able to do that. And you see a whole lot of interesting trends to pick up on, and maybe just to highlight one or two things. I mean, I think the first thing is that sometimes we've tended to treat our cities as if they're exactly the same, but actually we need to understand what are their particular comparative advantages. So Johannesburg emerging as a financial professional service hub, Durban manufacturing, logistics. You've got a place like where we are, Tshwane, with government services, more resilient. So I think seeing how that urban system fits together requires better granular information. And we've actually, in the case of people working on the economic geography of the country, in South Africa, we really lag behind when you look at advanced economies in the north. There's a huge focus, many economists and regional planners looking at the changing economic geography. But in South Africa, economists tend to just look at the national outcomes. And I think this is this issue of sometimes we haven't had data in the first place to actually unlock people starting to take that local lens. And I started the project by showing you that provocative image about why geography matters. It really does matter. I mean, South Africa has a history of kind of apartheid spatial planning. So I think it's a really promising project. So thanks.
Yeah. If I think of the splash that, say, Raj Chetty has made with some of the work that he's done at the district level in the United States, I think there's so much. It was really exciting playing around with your dashboards yesterday, and I think the health data can give us great insights at the local levels. I think we have roving mics. I'd like to take some audience Q&A. So if you could indicate yourself, and a mic will be passed to you so that you are able to interact with the panelists on stage. Can we see a show of hands so that mics can be distributed? All right. So we've got two questions over here. Can we just take, okay.
There you go.
Yes, sir, please.
First, I asked the question.
And the lady in the red. Yes, please go ahead, ask your question.
Okay. One question I've asked here, but I've got a question I forgot the gentleman's name. He says Cape Town seems to be the front runner in digital transformation. And I actually looked at the IMD reports. Cape Town is number 37 in digitalization, especially in smartness in general. What do you think sets Cape Town apart that it can actually be able to do what other areas can't? That's one question. And the second question would be then, what about those, and I think maybe Alison is the best person to ask that question, to answer the question. What about those communities where there is no financial backing, those that are actually excluded digitally? How would they be comparing with the Cape Towns of the world?
Right. And the lady in the red. Yes, please, ma'am.
Thank you so much. Great presentation, Andrew and Justin. For me, as we are unlocking the data that is available, and we are now celebrating 30 years of our democracy in South Africa, I'm just curious about the data that is currently on paper, because at some stage we were stuck in paper. So that data that is still there, I see that maybe it's still widening the data gap. So if we are to say we have to go digital transformation, how are we going to incorporate the data that is still on paper, so as we are able to try to inform the policy and the planning that we are trying to wrap up for this current cycle, and we are then in an attempt to use these artificial intelligence techniques. Thank you.
Okay. So, shall we start with the digital divide, Justin, and then?
Yeah, thanks for the questions. I mean, just to point out, it wasn't just Cape Town, right? We've had eThekwini as well, who've been sort of more front runners. And I'm referring to those within the metros that we're interacting with us as the project team and sharing with us lessons and collaborating with us. So, what sparks it in one place and not another is an interesting question. But I think that that it's important that we start to create these assets that start to move the dial forward. And in some places it might be slower, and we need to be realistic about it. And some places will have higher uptake. But I think what's really key is getting the community going, that lessons can be shared between them. So, we think running this community of practice amongst local municipal planners and economists is a really important vehicle, because it's not just us here as experts with all the answers. Actually, other municipalities can learn from what eThekwini and Cape Town are doing. So we hope to widen the circle, get more people involved moving forward. Maybe also just to say, the point of what I was presenting here is not necessarily just about the project per se, right? But it's just to show that actually there is a lot of good that can be done if we think about these information flows that are out there. And not all of it is big data and as sexy as that. It can be a little bit more emerging. It can even be on paper. But I think the point is that we need change agents in government to be thinking about what it is that your area of expertise are, what are the information flows, and how can we start to tap into those things, because it's actually a resource that can be fairly cost effective once it gets going. There are upfront costs in trying to generate the capabilities, etc. But actually, once the system is going, because those flows are sort of going on in terms of people's daily activities, it actually becomes really cost effective. So even with this tax data project, every year we can now add another year's worth of data, and in some ways it's just rerunning the code. So I think, the potential dividends are really big. Maybe one other thing to say is that I don't think we should just see it as an either-or situation. We still need Statistics South Africa to go in the field and do what they're doing, right? For example, the tax data gives you a lens into the formal economy. but the formal economy is not everything. Yes, it is most of GDP, and it's probably about 80% of the workforce. So in our case, it's a large part, but there will be marginalized and excluded groups, so I think it's important as one tool in the toolbox of trying to sort of improve decision making, but not the answer.
Yeah,
Thanks.
I see the master of the house is looking at me with dagger eyes. So,
Salambi,
while I did
yeah,
want to take Andrew's insights on how we deal with paper-based records, I will point out, Andrew, that your paper on the population data center in the Western Cape actually has some thoughts on digitizing records. There's some interesting advances happening in deep learning, particularly around these paper-based records and giving them a digital footprint. So I encourage you to interact with those resources. Justin, as I said, I'm pretty impressed by the dashboard that you've put together, and anything we can do, the upfront cost that you've talked about in actually getting a new edition of the city's economic outlook. That's going to be some exciting work. So ladies and gentlemen, I don't want Vusi to have a heart attack over there. May you please give a round of applause to our panelists. Thank you very much.